Well, good afternoon, everyone. My name is Mark Skidmore. I'm the director of the North Central Regional Center for Rural Development, or NCRCRD, and welcome to today's webinar. The title of our webinar is The Relationship Between Opioid Prescriptions and Child Removals. This webinar is sponsored through a collaborative project between Purdue University and the NCRCRD. It began as part of a Rural Health and Safety Education grant and is continuing with support from SAMHSA. So I'd just like to acknowledge that and welcome everyone to the webinar. Today's webinar speaker is Professor Troy Quast from the University of South Florida. Dr. Quast is an economist who received his doctorate in economics from the University of Florida. His research interests include the impact of the opioid crisis on children, the relationship between economic fluctuations and health outcomes, and the impact of natural disasters on health status and the utilization of health services. And so I'd like to welcome Troy, and also for those who are participating, you can see down below you'll have a chat section. So as he's going through his presentation, if you have any questions or comments, please feel free to type those in and he'll catch those along the way. Actually, I see the chat is right on the right-hand side here. We kind of redirected to move things around a little bit. So with that introduction, I'd like to pass it on to Troy. Thanks again, Troy, for being with us.
Oh, thank you very much for having me. It's definitely a pleasure to be here and to speak to the folks in the group today. And as Professor Skidmore said, I'm happy to take questions as we go. If I can answer them as we go, I'll do so, but if not, I'll definitely address them at the end of the presentation. So let's go ahead and jump right into it. So give you a quick outline to what I'll talk about today. I won't spend much time talking about the outline itself, but give you some quick background on me and my research in this area. Some discussion regarding child removals and the data I use. And then the meat of the presentation is to look at the 3 studies that we've done so far in this topic, looking at Florida, California, and then in a national perspective. And then we'll talk about some takeaways and limitations to the research. And then if I haven't already, I'll be happy to take any questions or comments you have at that point at the end there. So again, a little quick background on me. As Professor Skidmore mentioned, I'm an economist. I have kind of a diverse, some would say scattered research agenda. He kind of alluded to the different areas I'm looking at. But generally my goal in my research is to try to use data to address and understand significant health questions that pose to society. In terms of this line of research, it actually came about on a roundabout basis. I've learned of the potential relationship between opioids and foster care removals. This has both first and secondhand. Secondhand, through reading news reports in the past, and where there were a lot of concern that state officials that the opioid epidemic was leading to a lot of child removals, but also first-hand basis for myself. My wife and I are actually fostering a child here in Florida, and as soon as we were licensed to foster, we were had pretty much an avalanche of requests to take additional children. And so, talking to some of the caseworkers and asking, what was the reason for this, so many calls that we're getting, and a lot of them will point to this potential of the opioid epidemic. A lot of parents were being inhibited from taking care of their children, and a lot of kids were entering the system. And it says there, I was as an academic, I kind of went to the literature look and see what was done on this topic, and really surprised by the lack of research on this question. So that was kind of my impetus to jump into this topic. In terms of foster care system, and I guess I should preface this with my background. I'm still relatively new to this notion of child welfare and also into the opioid area. So in terms of your questions and comments, I'm happy to hear your expertise on this as well. But quickly discussing the topic of child removals, as it says there, grounds for removals can include when the child has been abused, neglected, or abandoned, or suffering, or is in imminent danger of illness or injury. And it says there's selected potential maltreatments that can be identified when a child is removed: physical abuse, sexual abuse, neglect, parental drug and alcohol abuse, and as well as abandonment. So, and to be clear on this potential maltreatments, there actually be, when a child is removed, multiple maltreatments can be identified. So it's not as if it's one or the other instances where a child could be removed for, for example, for neglect and parental drug abuse. The data that I use to look at this issue is the AFCARS data. It says there, the Adoption and Foster Care Analysis and Reporting System. it's a mandatory system that all states must report their foster care data to. And so it's tied into the funding that states receive from the federal government. So it's arguably a pretty accurate representation of the number of the situations of foster care throughout the country, given states are dependent upon that reporting for their funding in some extent. The key variable we use in the study is the number of children removed by county, and I say year, but you'll see one of the studies we look at quarterly, but by county and cause. So we're looking at how many children removed in that county in a given time period and for what cause. And we normalize that number of children by typically the per 1,000 children in that county. Okay? And as I mentioned a second ago, children may be removed for multiple causes. So if you would ever look at the counts of kids removed across the different causes, you would potentially double count the children, just to be clear about that. Okay, so let's dive into the Florida study. This is the first investigation we did in this area. So it says there we looked at Florida data from 2012 to 2015, used annual data in that study. And as mentioned before, we use the number of children removed per 1,000 children aged 0 to 19. And the three areas we looked at for this study were for all causes, and then also for parental drug abuse, and then also for parental neglect. So those are kind of the three main areas we looked at. And the variable we use to control for the prescriptions is the number of opioid prescriptions per 100 capita in that county. Okay, and so as I said there, that data comes from the Florida Prescription Drug Monitoring Program, which in Florida is a pretty robust system that the physicians and pharmacies must report their drug prescriptions to. And just to give you some feel for how large these variables are, for instance, the number of children removed per 1,000 for across all causes is 4.3 in our sample period. And then whereas the number of opioid prescriptions per 100 capita during that sample period was roughly 93.4. So in other words, on average, per 100 individuals, there were 93.4 prescriptions for opioids in a given year. Opioids were not certainly the only potential influence on the number of kids removed. We also try to control for other variables in the study. So for instance, we looked at different types of drugs, for instance, benzodiazepines, stimulants, we included the prescription rates for those. We also included demographic variables, including population percentages by gender, race, ethnicity. And to control for potential economic effects, we also include the poverty rate as a potential confounder to influence that could potentially influence the rate of child removals. And also, based upon some of the concerns expressed in the news, we also looked at the analysis. We separated it by quartile of white population proportion. So in other words, we ranked the counties from those having the least or lowest proportion of whites to those rating or having the highest proportion in 4 separate categories, and looked to see if the relationships that we saw for the overall state appeared to vary when we split up the counties into those 4 groups. What do we find? So we found that, and I'm going to use a term here that for those of you who are not too keen on statistics might make you cringe a little bit, but it's idea of a standard deviation, that term you see on the screen there. Standard deviation, think of it as just a measure of how much a variable typically varies. Okay, so kind of the typical movement of that variable. So it says there, a 1 standard deviation increase in the prescription rate in this sample for our data was associated with a 32% increase in the rate of removals due to parental neglect. Okay, and so kind of given some context to that value there, this 1 standard deviation increase that was correlated with roughly 2,000 additional children removed from their homes. And if you put that in a financial perspective, on terms of the cost to the state, that results, if you a rough estimate of roughly $20,000 per child per year, that comes out to roughly $40 million per year. Okay, so again, 1 standard deviation increase in that prescription rate is associated with that, roughly $40 million per year increase in state costs. And as I mentioned, we did look at that analysis by white population proportion in the quartiles, and for those counties that had the highest proportion of white residents, those associations were twice as large or even larger than those in the counties with the lowest white population proportion. So, somewhat extent confirming this conventional wisdom that the opioid crisis had especially strong effects in largely white areas. Okay, so that was the Florida study. We next turned our attention to California. And California was a little bit different study in that, first off, our data set was a little bit longer in terms of time period, 2009, 2016. And for California, we're also able to obtain quarterly data. So it gave us more frequent data, which arguably gave us a cleaner measure of how closely related the opioid rates, opioid measures were to child removals. And you see there we have the same outcome variables, again, number of removals per 1,000 children for those 3 different causes. But our opioid variable is a little bit different in this analysis, and arguably a little bit better. We're looking here in this analysis at the rate of residents prescribed 90 or more morphine milligram equivalents, or MMEs, per day. That 90 MMEs per day is actually a CDC threshold that CDC has established as prescriptions above that level are problematic and could lead to dependency. So again, we have a measure now in this study that is more of, rather than just the number of prescriptions, more of a precise measure of potentially the overuse of opioids. And as we see there, data came from the California Opioid Overdose Surveillance Dashboard, which they then generated from their prescription drug monitoring program. So again, we want to allow for different factors to potentially affect the rate of removal. So we control for the average wage in a county in that quarter. In terms of the potential for criminal justice issues, we also control for the average number of jail bookings in that county per quarter. And as in the Florida study, where we disaggregated the data by the proportion of counties in terms of their white population proportion, in this study we looked at separating the counties by urbanicity. So again, hopefully a topic, or I would imagine a topic of interest of many of you listening in today. And we use the rural-urban continuum code as our measure, and we group counties into these 3 groups in terms of metro counties, rural counties that were adjacent to a metro area, and finally rural areas that were not adjacent to a metro area. What do we find in this study? We found that, again, that 1 standard deviation, that again is a measure of how much the high dose prescription rate varies on a kind of a general basis. That 1 standard deviation increase in that measure was associated with a roughly 10% increase in the overall child removal rate. So essentially saying this variation, this high dosage measure, is associated with increases in the removal rate for children. And when we broke down the analysis by urbanicity, we saw that the associations that we measured overall were largely limited to rural counties that were adjacent to metro areas. And to us, that was kind of a surprising and, frankly, a result that we could not clearly identify, because, why we saw that association in rural counties that were adjacent to metro areas, we really didn't see much of an association in rural counties that were not adjacent to metro areas, was an area that, or a result that we definitely could not easily explain. Okay, so the last of the 3 studies took more of a national perspective. So we're looking here in the United States as a whole. And our sample here was, again, now back to using annual data. And it says we use US counties, but you see the asterisk there. That asterisk indicates, or is a note that we don't have data for every county using these in terms of the foster care removals, or the child removals, I should say. Within the data that we have of the roughly 3,100 US counties, roughly 2,000 were unidentified. Their identities were masked because they didn't have enough, or I shouldn't say didn't have enough, but they didn't have a threshold of 1,000 foster care episodes. And so we had to aggregate those 1,950 counties into kind of state-specific pseudo counties. So kind of a little bit of a minor detail there, but just to be clear, we don't have data for every single county. Some of these counties we had to aggregate into what we're calling pseudo counties. In terms of our removal variables, now we're just looking at all causes and parental drug abuse. And then our opioid measure here is the number of opioid prescriptions per 100 residents per year. So that reflects, again, that same variable we used in the Florida study. However, you'll note here, this is a different data source for us. This is, there's not a national clearinghouse, at least that we know of, that have data for all states' prescription drug monitoring programs. And for that matter, there are many states that do not have those programs. And so for this paper, we used data from the Quintiles IMS data warehouse which is a survey of roughly 90% of all retail pharmacies. And so this is not arguably as a complete measure of opioid prescriptions, but again, now we have this national perspective that we're able to look at all U.S. counties. Again, we included some control variables to account for different factors that could influence the removal rate beyond opioid use. So we have the demographic variables, the proportion of residents by gender, race, and age, ethnicity. Also, the poverty rate and unemployment rate were again used to control for economic fluctuations. And the curve here, was the Florida study we looked at proportion of white residents. The California study we looked at the urbanicity. For this study, we wanted to look at the differences in the relationship between opioid prescriptions and child removals by state to see if there were distinctions by state. And so you see in this slide here, this is a map of the US, obviously, and we have here color-coded according to the relationship that we observe. So the way to read this map is those counties with the green county, I should say the states with the green shading, are those states that had a positive relationship between the opioid prescription rate and the extent of child removals. So in other words, in those states, as opioid prescription rates went up, the number of removals in those states tended to go up as well. And so the darker the color indicates the larger the relationship. And the reverse is true for the states in the blue. So in other words, the bluer states are states that in which as the opioid prescription rate went up, the level of child removals actually decreased on average for the state. Okay, so one aspect of this map that struck us was that there's not an especially clear pattern geographically in terms of the green versus the blue states. You see is largely a smattering of, within the U.S. across. There are some interesting exceptions to that. For instance, you'll see Wisconsin and Illinois have are dark green states. So those are states that have relatively large positive associations. So as the opioid prescription rate went up, the rate of child removals went up, especially more in those states. And then in terms of the states that actually had a negative relationship, you see there's the largest one there is New Hampshire. The results for that is that a 1 standard deviation increase in the prescription rate in that state was associated with a nearly 30% reduction in the rate of child removals. Okay, so for us, this is a pretty surprising result, to some extent, and I expected in this context, a green map throughout the U.S. that you'd have this positive relationship, but this analysis tends to suggest that it's not uniform across the U.S. Okay. So kind of takeaways and limitations from our analysis. So the takeaways, I would argue the Florida study shows that there's this, or indicated there's a positive association between removals and prescription rates. And as I mentioned before, it seemed that that association was especially strong in counties that had high white population proportions. The California study is suggested that the positive association between removals and high dosage prescriptions, but again, we saw a distinction there where the association was especially and almost limited to those rural areas that were adjacent to metro areas. And finally, for the U.S. as a whole, that analysis showed that the relationship between removals and prescription rate actually varied somewhat across states. And I kind of avoided trying to give any hypotheses as to why that is the case or what could be driving that. And to be especially clear, we cannot come to any conclusions based on our data. But one topic or one potential explanation that we think might make sense is that this could be related to the stage of the opioid crisis in the state. In other words, potentially for some states that are maybe further along in the opioid crisis, maybe it's come to the point where and this is again very speculative, so for those of you who disagree, I'm not going to claim that this is the only way to think of it, but one potential explanation would be that maybe in some states that have the advanced stage of the opioid epidemic, the policies that are reducing the level of opioid prescriptions could potentially actually be leading to increased illicit opioid use. And those illicit opioid utilization could be more dangerous and more problematic and lead to increased child removals. So again, very speculative, but just one potential explanation that we surmise could explain that variation across the U.S. And in terms of the limitations, which again, this is an incomplete listing, and I'm happy to hear about other suggestions about limitations to this analysis that those of you who are listening may have. But arguably the most important one is this first one, that our estimates only reflect associations, not causations. So we definitely can't say that a 1 standard deviation increase in the opioid prescription rate caused a certain change in the rate of child removals. These are just associations. We don't have the statistical ability to say one caused the other, so that's a very important caveat to our results. We definitely cannot control for illicit opioids. So we, as you noted in those 3 measures that we used to control for opioids, they're all based on prescription opioids. We're not able to control for the level of illicit opioids that could have important impacts on the rate of child removals, and to some extent, as I just mentioned, especially given the lack of regulation of those and potential increased danger of those types of opioids. Another aspect we don't control for are a diversion of opioids across counties. So if there's prescriptions taking place in one county and those opioids are being moved to a different county, our results would not pick that up, and that could be a source of bias in our findings. And another important caveat I want to mention, and this I think is important to note here, is that our analyses only look at that extreme outcome of child removals. As you can imagine, there are many, many instances of negative effects of opioids that do not lead to this extreme outcome of having a child removed from their home. And so for us, it's our way of kind of viewing the results as being maybe a lower bound for the extent of the problem, that you have many homes in which the child may not be removed, but where there's a potential for a very negative impact on that child while they're growing up. And actually, one other limitation I want to mention that's not listed here is that, and this is for those of you who are in child welfare, probably one of the limitations you're screaming at your computer monitor right now, wanting to point out, is that there's very different policies and procedures in terms of child removals across states and even within states and even over time. So I can speak for Florida, for instance. We passed a law in, I think took effect in 2015. I apologize if I had that year wrong. That changed somewhat the criteria by which children are removed from their homes. And we try to control for those types of changes statistically, but there are definitely, especially in the national analysis, there are many things going on within states, across states, that we can't perfectly control for, and so we cannot say our results are not biased by those instances. So with that, I will say thank you and take any questions or comments. I see a question from about how profitable it is for a doctor to prescribe an opioid. That is again, it kind of goes into the minutia of the kind of physician aspect of opioids. I cannot claim to have much insight into, and so I'll have to pass on that question.
Well, thanks, Troy. While people are perhaps typing in some questions, I wanted to share an anecdote here in Michigan. We have the Flint area, which is a struggling urban area, and it's primarily now African American, and we have the outer suburbs of Flint and the sort of the more rural, and so there's this dynamic that happens in Genesee County where the prescription opioid issue is happening on the outside of the city, but as the opportunities for prescriptions start to be cut back, then those people will come to the city looking for a low-cost way to meet their addiction issue with heroin. And so that, sort of thinking about the opioid crisis in a regional context makes some sense. So your result in California seemed to make some sense to me.
Sure. No, that's thank you for that anecdote. And I think from our perspective, this different I don't know, kind of patterns that are being observed really, vary within state and across the country to a large extent. And want to point out it's an important limitation of our analysis, this potential impact of illicit opioids. And we really, I would list, especially if there are any folks who are listening online, have any thoughts about how to try to measure that, because that's an aspect that we think is really important to try to address, and definitely is not addressed specifically in our research. I see a question here. How long are these children removed, and for what is the time frame of reunification? That's definitely an important question. The answer to that, I don't claim to have perfect information, but I do know that it definitely varies significantly across states. At least the average, for instance, in terms of Florida, I think the most recent number I saw was that the average time for, they call it a case plan time for a child in foster care is a little bit over 1 year. And so that average, as most averages do, masks a lot of variability. So there are some cases where, for instance, when a child is removed from their home, typically the parents are provided what's called a case plan, where it's um, a list of kind of accomplishments they need to make in order to regain their custody of their children, and that can include drug testing, might be psychological testing, it might be demonstrating income, demonstrating proof of residency. And for parents who are able to quickly make those adjustments, they can reunite with their children relatively quickly. And most states have a very strong preference for parental reunification. On the other hand, though, there are definitely cases that can linger for a long time. I don't want to bring my own situation too much in this conversation, but our foster situation is going on a little bit over 2 years now. And so it's a lot of variability. It can, and I want to be clear, I'm not claiming that my child's has anything to do with the opioid situation, but these foster case plans can take a long time and can go through lots of curves and redirections that can extend the cases for quite some time. Hopefully I answered that question adequately. If I did not, please let me know. Next question I see is, have you looked into the correlation between family treatment opportunities and child removals? That's actually a very important aspect that I want to actually start moving towards, because as I should have mentioned earlier, my limitation of this, or a very, very important limitation of this research, is that I'm just kind of claiming, I'm just trying to report on what's happening on the ground. I have unfortunately, this research does not provide any kind of direction as to, well, how could we potentially improve upon the situation? Well, one of the aspects that I do want to investigate very soon is to say, okay, well, we have a situation. Are there any instances, or any factors that potentially look to, sorry, I got a little distracted there. Any factors that potentially lead to a reduction in the rates of child removals? And one of the important aspects that I want to look at is this potential treatment opportunities. So, be it family treatment opportunities, if there's localities that have higher levels of substance abuse treatment facilities, if there's some type of return, or some type of kind of measures that can be taken to reduce the number of child removals, because as I said, this is right now, unfortunately, we're just reporting kind of what's on the ground and not giving any insight as to what could be improved. So the hope is that that type of analysis could lead to potentially resulting, oh look, there's a positive impact in terms of the availability of substance treatment facilities and the rate of child removals.
Troy, did you consider how many of the fostering situations are within the same family versus external to the family?
No, our data only look at instances in where the child is removed from their parents. So I don't believe we have the potential in our data to have that additional distinction.
Grandparents or something like that.
Yeah, no, kinship care is very prevalent, and I think that's a important issue to look at as well. But for us, we're just looking at the rate of overall removals.
Okay, thanks. As another question, do you think that it would be possible to test your hypothesis, for example, in Ohio or West Virginia, where the crisis is very advanced, versus a place where it seems to be a little bit behind, and the finding that you could imagine prescription rates tailing off, which they have over the past several years. But as those prescription rates tail off, there's a lot of evidence suggests that those who are addicted are turning to heroin or other illicit opportunities. And so I think your hypothesis is a reasonable one and maybe testable. Do you plan to explore that at all?
That is something that we would like to look more deeply into. we did some very preliminary kind of back of the envelope type calculations when we first did this, and try to see if there was any clear relationship. And if you go back to the self-control of the map here, let's see if I can do this here. I go back just to that map there. We try to just kind of do an eyeball test, and for us, it wasn't a clear pattern. We didn't see a pattern for those states that are kind of the ground zero of the origins of the crisis. Especially see, like, for instance, West Virginia and Ohio, we did not see association at all in those states. And so, our quick reaction to that was there wasn't a clear indication. But no, I think that's an important aspect to look into in terms of, is it a artifact of how far along they are in the crisis?
I don't see any additional questions coming in, but I do want to maybe take this opportunity to say thanks again for sharing this information. I think it's very important, and there are so many potential long-run implications of children being removed from their families that this highlights the very long-run implications and impacts of the crisis. So even as we get a handle on perhaps the immediate crisis, we can expect many years of ongoing challenges that are indirect as a result of it, and so I think your work highlights that.
Oh, well, thank you. And again, I appreciate the opportunity to share our work with the audience.
Yeah. Well, okay. So I don't see any other questions coming in. So maybe now is a good time to say thanks again and wish everybody a good rest of your afternoon.
Thank you, everyone.
All right. Take care.